And so today, once again, we have Ms. Sylvia Lemus from Sonoma County, and she's here to update us as to what's going on with the numbers, as always, in regards to COVID, and what is this new plan that the county has in order to change the situation with being in
Mhm,
purple. And again, in this situation, it's important that people understand purple is really the worst situation that we have.
mhm.
Um, and we don't seem to be getting out of that. Can you start with telling us the latest numbers, the latest data, and
Mhm.
then again, give us information about this new plan?
Yes. Thank you, Rafael. I'm glad to be here to share information. So to begin with, for the COVID count and the data, is we now have a total of 9,073 cases, which is an addition of 57 cases in the last 24 hours. We have, unfortunately, a total of 134 deaths, and we have testing a total of 205,901 tests that we completed, which is an addition in the last 24 hours of 1,426. But that number is really going to increase because we have, as you were stating, a new program, a new plan that was just approved by the Board of Supervisors this week. And so I was hoping to share information that I have about that today. So the first thing is that this is a new plan that we are going to be entering into at the county, along with other organizations, partner organizations. So what happened is that we have been doing more studies and measurements about why we're in the purple. Why we're in the purple. Where are we at? And we've talked about the metrics, how we have the case numbers and percentage of positivity, and then we also have the equity positivity, the equity numbers of positivity. So that's a number that we need to make sure that we kind of reduce the percentage of the equity positivity cases. And so that's where we're having an issue. We're having a hard time with that. So we did some GIS tracking of community countywide to find out what are the census tracts that we need to really support and really put resources into those areas and see what we can do to do like a multi-prong approach to try to correct the problem. And one of the issues that we're finding is that in a lot of these tracts we have, for example, essential workers that are living on limited income that have to work, can't afford to miss work. A lot of them may not have paid sick leave or job security to be able to take time off. They could live in shared space due to lack of affordable housing. They might share transportation, and they have a lack of healthcare access. So a lot of these are reasons, why we're seeing the numbers as they are. Um, so what we did is we identified these targeted census tracts, targeted zones that we identified that we're going to do everything that we can through this new program that we're starting implementing this week. The biggest thing is testing. I want to say we're doubling, but I want to say we're more than doubling the testing. And I will be sending you a list because even out within the hour when we started this program, I got more testing sites. And so we're going to be testing at least 2 different locations throughout the county every day of the week except for Sunday. Um, and those testings are going to be just from week to week at the same locations. And we really encourage the whole community, whether you have symptoms or not, to go and be tested. And we actually have incentives now for people that are being tested. And I'll talk about this in a little bit, but we want to remind people that you don't need to have the tests are free. You don't need to have insurance. You don't even need to have an ID or medical insurance. And it doesn't matter what your immigration status. We want to test everybody, especially people that live in those areas. And when I was talking about the census tracts, these targeted um, um, zones in the community, we have on SoCoEmergency.org a map that you can go in and you can put your address. You can find out if you live in one of those targeted zones that we'll be concentrating on. So what we have done is, like I said, we're more than double the testing. I'll be providing you information on that. And we also have entered into a contract with On the Move, and they have a program called La Plaza, La Cultura Cura, and they developed a program that has already rolled out this week. Actually, I think it rolled out maybe earlier, but it's called Project Cura, which is the COVID-19 Urgent Response and Aid Project. And what they're doing, they're partnering with multiple family resource centers and other agencies that are embedded in local communities to provide information to farm workers, local laborers, and communities of Latinx and Indigenous communities. And we're going to be providing PPE equipment, for example, for farm workers and other high-risk workers, connecting individuals to medical support services, supporting outreach for like neighborhood testing events, and emergency financial assistance. And that's one of the big things that we implemented here. some of our neighboring Bay Area counties done it with success. And so we are going to be providing financial assistance and incentives for residents of those impacted communities. So for people that are living on a limited income that live in those communities, we're offering a $30 gift card for taking a test. Whether you have symptoms or not, we want everyone to be tested because that's the only way we're going to be able to find out who has COVID, because sometimes we don't have symptoms from it. So, and we'll be able to kind of isolate or quarantine or whatever we need to do to kind of help the community in that area. And also, if we find out if it comes out that people are positive and they have to isolate or quarantine, we will be provided wage replacement of 1,216 for the 14 $1,216 for the 14-day isolation period that's required. So what we've seen, and I forgot to mention in Spanish, is that this type of an approach, we can predict based on other similar counties that have done this, the incentives, a 50 to 75 increase in testing demand. So we're really hoping to see, that type or more of demand for testing based on these incentives that are happening in the community.
which naturally will show up a higher number of positive tests.
Mm-hmm.
And that's perfectly fine because we want to
Mm-hmm.
identify anybody and everybody who has
Yes.
the COVID or has had COVID. And then, as a result of that, be able to either, as you mentioned, isolate them. That way, they don't
Mm-hmm.
continue to share the virus with other
Right.
individuals. Yeah.
Yeah, and sometimes people are afraid of the high testing numbers, but the more testing we do, we get credit from the state.
Yeah.
When they do the calculations, they credit us for that because they know what
Yeah.
they were doing higher testing, more testing. So our numbers are adjusted for that higher testing that we're doing. So
Yeah.
it's still a good thing for us to do
Hmm.
more testing.
Definitely.
Yeah. So part of our plan again is that we're going to partner with the business community because we're going to try to do a public-private partnerships because we're finding that we need to help also educate and the businesses so that we can kind of create partnerships with them, do on-site testing. For example, we might be working in a partnership with Jackson Winery so that the workers can have on-site testing there on site, incentive programs, financial support. So we're working with the business community to try to develop these type of programs. So it's more of a multi-pronged, all sectors are involved because it's going to take the whole community to really make an impact in the COVID, so that we can bring the numbers down. So we'll be working along, like I said, to work with the business community. Isolation and quarantine support, we'll be providing that as well. So we currently have a hotel in Hillsburg that we contract with that we can, if people need to isolate so that they keep their family safe, we have a place that they can go and we feed them, we provide resources, even financial assistance while they're in isolation. But what we're trying to do right now is also find other hotels around the community in some of those zones that we talked about so that they're closer, to their home base, yet still being able to isolate away from their homes. And we also provide them with other kind of services like medication delivery, laundry services, just whatever services they need to be able to isolate safely.
Yeah.
And
And
in
again,
addition
we
to,
continue to see that, and we need to
Mhm,
truly understand that we can look back and we can say if we had done this three
mhm,
months ago, right?
mhm,
But we
right,
can say it's being done now,
mhm,
and we need to be supportive of this approach so that we
mhm,
can get out of purple and go to red and whatever other colors in this magical
mhm,
rainbow that we are dealing with. Because as I mentioned in Spanish, Dr. Fauci and
mhm,
Dr. Mays are experts on this type of prevention and getting the virus. And what they tend to say, what I know Dr. Fauci has said it on national television, and it's like if we all just wash our hands, wear our mask when we absolutely have to go out, and then avoid going outside if at all possible,
mhm,
then restrictions wouldn't have to be the way
mhm,
they are, but
mhm,
also the numbers wouldn't have to be what they are. And it's either neglect from people who just, oh, the virus is not going to bother me, blah, 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 blah,
mhm,
or simply ignorance and not choosing perhaps in an
mhm,
ignorant way not to wear the mask properly or think that again it's not going to happen to them. And
mhm.
we've seen the consequences, and as you
Yeah.
mentioned recently 5 people passed away in
Mhm,
Sonoma County. And as long as
mhm,
this keeps happening, we'll never get out of purple. And that
mhm.
is a problem. So,
Yes.
additional testing, additional resources that the county is starting to provide is
Mhm.
exactly what needs to happen.
Yes, and we will be doing an expanded communication campaign strategy around education and marketing. So you'll be seeing a lot more TV ads, more radio ads, and not just that. We want to work, and especially me, want to work with our community partners because the community organizations, community partners are the ground troops that really know the community, that know the mothers and the youth, and So I want to be able to work with them to provide resources, flyers, different information to try to get the word out and really saturate the county with information about the importance of testing and resources and everything that we have. So that's something that you'll be seeing an expansion of coming up real soon.
Definitely. And so it's really, I appreciate you always bring a lot of information. I think it's
Mhm.
a positive thing that you're bringing this new information to us, to the community. And again, send us whatever flyers, whatever information you have. We'll be more than happy to share that with the community. And for our listeners, if you go to DACA, Sonoma County, that is DACA, Sonoma County, you will be able to find all of this information and any other information that the county sends to us so that you are as informed as possible. Is there anything else that you may have for us?
I wanted to share that Dr. Bates gave her presentation that she gave to the board, which includes a lot of the metrics and information. And she gave that this Wednesday. So if people want to see it and they didn't have a chance, it's available in English and Spanish on the County of Sonoma Facebook page. It's only 30 minutes, but it's very informative.
Definitely. And so, again, please check that information out. And again, thank you for taking the time. I know we've been doing this for months now. And
Hmm.
as long as I have this show, we will always dedicate some time.
Thank
The
you.
more educated people
Mhm.
we have, the less the issue continues to be. Thank you.
Yes. Thank you, Rafael. Bye
Definitely.
bye.
Take care.